Hey everyone, today we are gonna talk about septic shock, a very important topic for all exam point of view. So please jot down all the key facts. Septic shock commonly caused by gram-negative organisms, sometimes gram-positive, sometimes fungal organisms. So gram-negative organisms, E. coli, meningococcus, these are the common ones. And here they release endotoxins. Endotoxins bind to the CD14 receptor present on WBC and endothelial cells, causing the activation of endothelial cells, releasing nitric oxide. Nitric oxide, as you know, nitric oxide, and also there is release of prostaglandin I2, which causes systemic vasodilatation. So there is initially a hyperdynamic circulation, and later on, when there is a widespread endothelial damage with the spread of the toxin, it will cause a cold, clammy skin with loss of circulation. So the circulation may be hyperdynamic, then later on it collapses, and there will be warm skin initially, later on there may be cold skin, and there will be hypoxia related tissue damage. Why? Because there is a hyperdynamic circulation in the most part of the septic shock. That will lead to increased mixed venous oxygen concentration. Tissue will not be able to derive the oxygen from the fast flowing blood. That is the key component. And apart from that, there will be also acute respiratory distress syndrome, because the neutrophils will be unduly activated because of the macrophages activation, which release interleukin 1 and TNF, causing neutrophil adhesion, and that will more neutrophils get adhered to the pulmonary circulation, causing acute respiratory insufficiency. Not only that, guys, it will also cause disseminated intravascular coagulation. But why? Because of the hyperinflammation causing increased clotting pathways. So both extrinsic and intrinsic clotting pathways will be activated. That will cause basically the disseminated intravascular coagulation. So patient will die out of this multiple organ dysfunction syndrome, vascular collapse, acute respiratory distress syndrome, disseminated intravascular coagulation. These three are the major complications that are happening in septic shock. So septic shock, common source, as we discussed, indwelling catheter, retention of the urine, and the abscess or pneumonia. These have to be controlled. These source of infection have to be controlled. Antibiotics need to be given to contain the infection. And apart from that, there has to be basically fluid resuscitation and supportive measures have to be done. So these are the key facts for septic shock. So now let's have a very quick recap of the septic shock that we learned so far. It is caused commonly by gram-negative, gram-positive organism and also the fungal organism. There is an endothelial damage, severe endothelial damage, releasing nitric oxide and prostaglandin that causes hyperdynamic circulation, later on hypodynamic circulation. Common complications we learned: multiple organ dysfunction syndrome. Number 1, we discussed about the disseminated intravascular coagulation, how it happens, and we also discussed regarding acute respiratory distress syndrome due to the activation and adhesion of neutrophils. So these are the key facts, and also in the end we discussed how to manage and how to contain the septic shock. So it has to be contained by a combination of antibiotics, combination of the drainage of the source of infection, if it is pneumonia, abscess, or those kind of things, and also supportive measures like fluid resuscitation have to be done. And also the diagnostic features will be increased cardiac output, decreased cardiac output, and then there is increased mixed venous oxygen return. There is a decreased peripheral venous resistance due to the increased nitric oxide. So these are the key facts for septic shock. So hope you like the video. Please share, like, and subscribe, and also let us know what kind of a video you're gonna be seeing next, and also comment in the section regarding your feedback. Thank you, and keep learning. And also you can contact us directly for any kind of a pathology based learning, whether you are going for a crash course. We have launched a 10 days crash course, and we have also launched regular pathology coachings, so a pathology training for the students of different countries. So you can contact us anytime for individualized sessions. Thank you, happy learning, and see you in the next video very soon. Thank you.